Hello and welcome to the Oral Health Podcast. This week our main focus is going to be on nutrition and diet and how the different things we put into our bodies affects the health of our mouth. Today I am talking to Dr. Serena Sengal, who is better known to most as the Foodie Dentist on Instagram, about nutrition and oral health. It's a topic that she is very, very passionate about and very knowledgeable about, and I learnt a lot, so I hope you do too. Yeah, so do you want to just start off, if we can get a little bit of information about you, like what's your background and where are you coming from today?
Sure. Well, my name's Serena. I'm a general and cosmetic dentist and I work in central London. And I'm very, very passionate about oral health and nutrition. I started a online platform called the Foodie Dentist a few years ago, just simply as a passion project, just to kind of educate and inspire people about the power of nutrition for oral health, and just to create this friendly dentist aura, if you like, just because I wanted to, break that stigma that dentists are really horrible people. And I wanted to just provide really simple, effective tips, especially during COVID and stuff. People didn't have access to dentistry. So I just wanted to be that kind of friendly face of a dentist and just provide a bit of interesting dental tips and just providing slightly different and maybe controversial information about how nutrition actually impacts our oral health, because a lot of us just associate sugar with dental problems, but it's so much more than that. And I just kind of went on my own, and I was just super passionate about this area. So I just decided to share it online, and it kind of grew from there. I mean, I'm still working 5 days a week. This on social media and Instagram and TikTok is just loads of fun for me. I really, really enjoy it. But yeah, it kind of took from there, and I've been able, through social media, which has made to travel through over the world actually, through social media, work with incredible brands such as Oral-B and Zendium, and just speaking at lots of different events, doing lots of different podcasts. It's just allowed me to connect with so many wonderful people. So yeah, that's kind of my background and my journey a little bit in a nutshell.
That's incredible. Like, God, yeah, you're a very busy person.
I'm a very busy person. Everyone always asks me, like, how do you do it? And I think I'm just really organized with my time, as in my lunch break is when I film content. It's crazy. Like, I don't really ever stop. I mean, I sleep by 9 o'clock, like 9:30, I'm in bed, I go to sleep. So, but I don't like to sit and do nothing. I'm just a very time efficient person. Mm-hmm. So I would have planned my day, and even when I have a cancellation of a patient, I'm like, right, we're going to film some content. I'm very organized with my time.
Nice. It's nice to hear as well, someone so passionate about what they do. Like, that's one of my favorite things about doing my job and speaking to loads of people is you get secondhand inspiration from people, and you're like, yeah, this is great. Like, it's just nice to hear someone so interested in, like you say, the crossover between nutrition and oral health. And do you want to just talk about that a little bit? Like, how is what we eat actually linked to our oral health?
Okay, great question. And I can probably talk about hours for this, but I'll try and condense it a little bit. So essentially, so sugar is known to cause cavities and things like that. But what we don't understand is that we actually need a wide variety of vitamins and minerals to support our bone, our gum function, and even just our saliva function, which is so important in maintaining oral health. Like, for example, the bulk of our gum tissue is made up of collagen. We need a lot of vitamin C as well to support that and strengthen that. And even things like we buy products that kill kind of 99.99% of bacteria. We don't actually want to do that. We have what we call a microbiome in our mouth. We've heard of this when we talk about gut microbiome, when we talk about boosting good bacteria. And exactly the same thing applies to your mouth. You have good bacteria and you need to be feeding that. So even eating things like fiber and probiotics is so good for your oral health, because if you're boosting the levels of good bacteria in your mouth, that's going to help fight off against dental disease. So we don't just want to strip everything in our mouth and create everything crystal clean. We actually want to, because it protects us, saliva protects us, and all the different other functions. But we want to be feeding ourselves the right thing. Even things like hydration is so important in oral health. Even things like stress and immunity, everything alters our mouth, and the mouth is a really great way to kind of tell what's going on in the body. If you've got lots of gum inflammation and cavities, that's a sign that there's an imbalance in your body. That's a big sign that there's a bacterial imbalance. So it's really interesting what we can see from the mouth, and then we just talk about use this product, use that product, but we're not actually getting to the root cause of the problem. And I feel like dental disease is much deeper than just an expensive toothpaste or an expensive toothbrush that you can buy. It's way more than that, and we need to be looking at prevention at its core. Even things like vitamin K2, all these different vitamins have such an important role. And we take a multivitamin. We often talk about, like vitamin C is good for your hair, skin, nails and stuff. It's really good for our gums. So there's so many different things. It's a bit like eating a healthy diet. People say is good for my skin. I mean, eating a healthy diet in general, it has such an important benefit on your oral health. Even things like eating tough foods like vegetables and carrots and apples and stuff, it stimulates salivary production. It's a source of fiber, a source of vitamins and minerals. It's so good for your teeth. And people talk about, let's say, like fruit is really bad for you. And a lot of the studies are just based on fruit juices. So it's a concentrated level of sugar. And it's probably got in one, let's say, small glass of orange juice, it's probably got about 6-7 oranges. It's very unlikely you're going to eat 6-7 oranges in one go, but eating whole fruits is so good for you. And snacking and stuff, it can it's not very great for your teeth, but things like tough fruits and vegetables are so good for your mouth, and people don't really quite understand that. And it's even just using your chewing power and using your musculature and stuff like that, and stimulating salivary flow is important in preventing dental disease.
What are a few examples then of some oral health friendly snacks? Because when you're saying about crunchy and vegetables, the first thing I think of is like carrot sticks and things like that. Is there any other, like easy grab and go things that are healthier for your mouth than, let's say, crisps or chocolate?
Yeah. 100%. I mean, there's so many. I mean, there's a lot of now healthy snacks and like protein balls and stuff. I mean, what I do is I make my own snacks at home. I make energy balls, and it's filled with things like nuts, oats, raw cacao, a little bit of honey, and it's really, really like coconut, and it's really tasty. The thing is, it has to be sustainable for you. So what I say to people is, if they don't like eating celery sticks and carrot sticks and they find it really boring, then eating healthy is not going to be sustainable for you. Like, I actually have a sweet tooth, so I need something like a sweet snack, but I prefer to make my own. I need that like during the day, after lunch and before dinner, I need that. So it's just about doing what works for you and making healthy eating sustainable, because for me, eating a salad is really boring and doesn't fill me up. So I cannot eat a salad for lunch and dinner. And that's what people think healthy eating is. They think it's just eating like a plate of broccoli or a plate of salad and feeling hungry. And it's not like that. It's full of flavor. And, you can have like black bean sauce with lots of veggies and rice and stuff. It doesn't have to be boring. And I think that's what people's biggest misconception is that healthy eating is dull, whereas in fact it's not. And you should be including loads of stuff rather than excluding things. So when people talk about they need to eat healthy, they're like, okay, I need to cut down my calories. I can't eat this. I just need to have the same thing again and again. But actually, what's beneficial, and there have been studies on this, that including variety of plant-based foods and including things like nuts and seeds and a variety of fruit and veg is much more beneficial to you rather than just having the same thing again and again. So you want to try and experiment. You want to try and experiment with different flavors, even things like adding, salad dressings and things on your salad. If that's going to make it tasty and that's going to make it more sustainable for you, then all for it. Then you absolutely should be doing that. You should be adding flavor to your food to make it taste nicer, because then you're going to want to eat it more. It's just about including food that you love to make healthy eating as easy as possible.
What are a few things, like if you could just pick some foods out of thin air, as it were, that you should really look to include for your oral health? Just a few things that would be easy to add to the shopping basket, or things that actually are going to have a lot of oral health benefits in terms of like lot packed with all the vitamins and things that you need to keep your mouth healthy? And
that's a really good question. The answer is there is no like one or two foods that are amazing for your oral health. So water is probably the best thing for your teeth. But we need to eat and we need to survive. I mean, the thing is that any fruit, vegetable is good for your teeth. Fiber, bread, wholemeal rice, things like that is good for your teeth. But you can't survive on just fruit and vegetables and like plain bread and rice. So I would say in terms of snacks and stuff, then yeah, things like celery sticks, carrot sticks with hummus, or homemade energy balls, something like that, piece of fruit or something, that's fine for your teeth, that's really good for your teeth. But there's not one single food that's good for your teeth. It's just that a variety of foods is better for your teeth and overall oral health kind of long term.
And something I want to ask about quickly, because it's just something I think it would be good to get your perspective on. With nutritionists, and sometimes the advice nowadays for eating healthy is eating smaller meals much more often and like grazing. But that, from what I understand, at least can be sometimes not very good for the health of your mouth. Is that true?
100%. Essentially, I mean, every time we eat something, our mouth goes slightly acidic. It depends what sort of food or drink that we have. So every time we're eating, our mouth goes slightly acidic. Now, if you're eating multiple times throughout the day, let's say you're eating 7-8 times throughout the day, the pH in your mouth is going to continuously drop, let's say 7-8 times. And then your teeth are going to be a bit more vulnerable to things like acid attack. So the more times you eat throughout the day, the worse it is for your teeth. So I say to my patients, if you're going to have like a pack of biscuits, it's genuinely better for your teeth to have a whole pack of biscuits in one go rather than having one every hour or one every half an hour. So the less you graze, the better for your teeth. And that actually includes, even if it's super healthy foods, that still causes a slight pH drop in your mouth. Anything that you eat or drink, like I said, depends on the type of food, but anything that you eat, it still drops.
Like if someone's having like orthodontic treatment and is maybe being a little bit more careful in terms of like the crunchy foods and things, is there anything that you should just avoid completely food wise if you have like say fixed braces, or is everything fair game?
It depends. I mean, things like, sticky sweets and stuff, they can get stuck in between your brackets and it can be quite uncomfortable. If also it sits there and it's not removed properly, then it will cause cavities. I mean, the foods that I kind of, recommend to stay clear of or try to kind of limit as much as possible, definitely fizzy drinks. So fizzy drinks are kind of just acid for your teeth. It's really not good for your teeth. So Coke, even Diet Coke, diet drinks, all the same in terms of the damage it does to your teeth. It's really sticky sweets, so toffees and things that just literally sometimes they aren't washed away properly, or bits are left stuck in the pits of your teeth and they can cause cavities and things like that. But in terms of patients who have fixed braces, their cleaning just needs to be much, much better. Anything that they eat, unfortunately, you can get stuck because there's loads of surface areas for things to get tangled in. So they just need to remember to kind of clean regularly. But yeah, the sticky sweets and stuff are probably the worst for your teeth.
This might be a little bit of a roundabout question, but can you think of any examples where you've been talking to, say, some of your patients about their diet and or maybe their diet has really affected their mouth, but then they've changed it and it's started to improve? Is there any examples that sort of spring to mind where you can physically see the change in their diets had?
100%. I had this patient. This was actually the reason why I started this blog in the first place. There was a patient of mine a few years ago, and she was about 21, so a really young girl. She genuinely had a mouthful of cavities. Every single tooth was decayed. She had gum disease. She hadn't seen a dentist in about 15 years. She was eating a really, really unhealthy diet. And she was just such a lovely girl. I could tell that she was motivated. She wanted to make a change. She just didn't know what to do. She told me she would buy all these expensive toothpaste and, then she's starting to do the right things, but it doesn't seem to help. So, I had a really long conversation with her and a really long chat with her. And I told her, it's about baby steps. And she thought she was eating healthy. She would buy like a sandwich from Tesco and a packet of crisps and stuff every day. And she would buy a chocolate bar. In her head, she thought that was healthy, which I'm sure a lot of people do. But I just went through with her the small changes that she could make. And in terms of trying to cook a bit more from home, to hydrate more. And I showed her the correct brushing technique. And genuinely, when I saw her about 3 months later, it was a different person. And it made such a difference to her overall, like her gum tissue. Her oral hygiene did improve, but also you could just tell by looking at her mouth, her tongue color, like it was just, everything was just so much healthier. So it really does, it really affects you the way that healthy eating has, not just on like your skin and visual things that you can see, because sometimes people don't look in your mouth so much, but not just for your skin and your overall appearance, maybe they start losing weight and stuff, but genuinely for the health of your oral health, it makes such a huge difference. So for sure, I've seen lots of patients where, you just included those small little tips, because let's face it, I mean, if you bombard them with information, they're very unlikely to kind of take it on board and actually listen. So I think it's all about kind of bite-sized information, making small sustainable changes so that it lasts a lifetime. And yeah, there's loads of patients where I've seen a really nice improvement from just small tips that I've given just to improve their overall well-being.
It makes sense that, making those changes does actually physically make a change in your mouth. Yeah, like I say, before I really looked into it, I only really thought that it was sugar. That was like sugar, just cut that out, but everything else, fair enough, just brush your teeth. That's not it at all.
Not at all, no. And I really like the phrase, like, your mouth, people treat their mouths or their teeth like vases. We think that the more that we polish them, the better and the healthier that they'll be. But our teeth are very much alive. We have a nerve supply, a blood supply, and we need to nourish them from within, not just polish them on the outside. So that's the kind of analogy I use, that they're not dead things that you can just clean and they'll be healthy. It needs nourishment from within. Just like healthy eating, people will say, wow, your skin looks really nice, or your hair looks really nice. It's nourishment from within. And I think that's so important, and that people need to understand, and that it's something that takes, a long time to see as well, because healthy eating, you can't just eat a salad and tomorrow everything will be fine. It's literally, things have to be sustainable and for the long run. So it's all about balance, but it's just about getting to that stage where you feel like, I'm not on a diet and this is just how I enjoy to eat, but it's about finding what you enjoy. Like, there's loads of vegetables that I don't like. I really don't like mushrooms and tomatoes. I don't like them at all. So, but I love other plant-based foods. So it's just about experimenting and finding things that you like for it to be sustainable.
I love that analogy. I've never heard that before, but I'm 100% gonna use that. I love that. That's amazing.
Oh, I'm glad. And when I say it, people are like, oh my God, yeah, it makes so much sense.
That is brilliant. Well, I just want to thank you again for sitting and spending some time with me. It's been fantastic. If anyone wants to come and find you on social media, where's the best place?
So I'm on Instagram at the Foodie Dentist, and I've just joined the TikTok, which is a bit of fun, at Dr. Serena Sehgal. So you can follow me on both those platforms. And yeah, thank you very much for having me. It was a really nice chat. Always love talking about this topic. I can talk about it all day long.
Fantastic. It's been brilliant, Serena. Thank you so much.
Thank you. Thank you, Sophie.
So that was Dr. Serena Sehgal talking about nutrition and oral health. I personally really loved talking to her. It's very clear that this is a topic she cares very deeply about. And so if you want to go and follow her on social media, I'll put all of her links in the description of this podcast. Likewise, if you want to learn more about National Smile Month, follow at Smile Month on Twitter. On Facebook, just search for National Smile Month. And then we are on Instagram, just at Oral Health Foundation. You can also visit our website, www.smilemonth.org. And if you want some bespoke oral health advice, our helpline are always happy to help. All of their information will also be in the description of this podcast. Thank you for listening, and thank you again, Serena, for joining me.